Hello, let's discuss anatomy of the gluteal region. This is gluteal region. Gluteal region has gluteal muscles, it has lateral rotators, it has ligaments, okay, it has nerves, it has blood vessels, it has greater sciatic foramen. This is the greater sciatic foramen and lesser sciatic foramen. Okay, so let's discuss. First we will discuss the gluteal muscles. Gluteal muscles are three in number: gluteal, gluteus maximus, gluteus minimus, and medius. Okay, so in this diagram, this is the gluteus maximus, cut end of the gluteus maximus. Okay, this one after the gluteus maximus is more superficial, then after that is gluteus medius, and the deeper one is gluteus minimus. Okay, gluteus medius and gluteus minimus. So the gluteus, about the gluteus maximus, it originates behind the from the region or behind the posterior gluteal line, and it insert on the here. This is the insertion of the gluteus maximus muscle. Okay, you can see it inserts on the posterior aspect of the femur on the gluteal tuberosity, and it is the main extensor of the thigh. The main extensor of the hip, main extensor of the hip is gluteus maximus, and it is innervated by inferior gluteal nerve. Okay, so the only innervation of the inferior gluteal nerve is the gluteus maximus muscle. Okay, so in this figure you can see the inferior gluteal nerve. This is this one, you can see it. This one is inferior gluteal nerve. Okay, this is inferior gluteal nerve. So this is gluteus maximus muscle. Now the two other gluteal muscles are gluteus medius and minimus. These are the abductor and the medial rotators of the hip. You can see this is the gluteus medius and this is the gluteus minimus. Okay, so this gluteus medius originates from the gluteal region or the gluteal surface of the ilium between the posterior gluteal line and middle or interior gluteal line. This is the gluteus medius, while the minimus originates from the gluteal surface between the interior gluteal line and inferior gluteal line. So this is gluteus medius, and both of these insert on the, this is the gluteus medius, and the other side, on the other side is the minimus also. So this insert on the greater greater trochanter of the this femur. Okay, so greater trochanter, this is the greater trochanter. So gluteus medius and minimus insert on the gluteus, on the greater trochanter of the, this one is greater trochanter. Okay, so this is gluteus medius, this one, and this is the gluteus minimus, and these, both of these are hip abductors and medial rotators. Okay, along with these muscles, the tensor fascia lata is also the hip abductors and medial rotators. In this diagram, the tensor fascia lata is this. Okay, tensor fascia lata. It attaches to the iliotibial tract. I will show you the iliotibial tract. So this is iliotibial tract, and it gives attachment to the two muscles. One is tensor fascia lata and the other is gluteus maximus. And how it is formed, the iliotibial tract is basically the thickening of the deep lateral part of the deep fascia of the thigh. Lateral part of the deep fascia, when thickens, it forms the iliotibial tract. And iliotibial tract, superiorly it attaches to the iliac tubercle of the iliac crest. Okay, this is the iliac crest, and its outer lip has tubercle, iliac tubercle. So it originates from here and then it attaches to the tibia. Okay, so this is iliotibial tract. And what is the function of the iliotibial tract? That it fixes the femur during the standing and walking. Okay, so this is the iliotibial tract, and the tensor fascia lata attaches to it. Okay, so the tensor fascia lata, the gluteus minimus and medius, they are hip abductors and medial rotators of the thigh. And what is the innervation of these muscles, these hip abductors and medial rotator? It is innervated by superior gluteal nerve. Okay, so this is superior gluteal nerve. You can see this is the superior gluteal nerve. Okay, so these are the hip abductors or medial rotators. We also talk about the iliotibial tract, the gluteal muscle. Now we will talk about the lateral rotators of the thigh or hip. Okay, so the lateral rotators are the first one, this one, below this gluteus minimus, sorry, below the gluteus minimus you can see this muscle. This is piriformis. It passes through the greater sciatic foramen and attaches to this greater trochanter of the femur. Okay, so this is piriformis muscle. This one is piriformis. Okay, below the piriformis, this is now first I will talk about this muscle. This muscle is pass through the lesser sciatic foramen. It attaches to the obturator membrane, and then it passes through the lesser sciatic foramen to come into the gluteal region. This muscle is obturator internus muscle. Okay, this muscle is obturator. This is cut end of two cut ends of the obturator internus. So this is obturator internus, this one. Okay, this one and this one. Okay, the obturator internus. So above the obturator internus muscle there is superior gemellus muscle, and below this superior the obturator internus is inferior gemellus muscle, and below the inferior gemellus is quadratus femoris. Okay, so what are the lateral rotators of the gluteal region? They are piriformis, superior gemellus, obturator internus, inferior gemellus, and quadratus femoris. Okay, they are lateral rotators. And what is the nerve supply of the these lateral rotators? So piriformis, this muscle piriformis is innervated by nerve to piriformis. Okay, this muscle superior gemellus and obturator internus, these both are supplied by nerve to obturator internus. Okay, this inferior gemellus and the quadratus femoris is innervated by the nerve to quadratus femoris. Okay, so these are the lateral rotators of the gluteal region. Okay, now if we talk about the the nerve supply, I will also show you the nerve. So this is the nerve to quadratus femoris, supplying the quadratus femoris muscle and inferior gemellus. Okay, this muscle is the sciatic nerve, which supply the like the posterior thigh, the whole leg and foot. Okay, so this is the cut end of the sciatic nerve. This is the other cut end of the sciatic nerve. Okay, this one I talk about it before. This is the inferior gluteal nerve. Okay, along with the inferior gluteal nerve, this is the posterior cutaneous nerve of thigh, or posterior femoral cutaneous nerve. Okay, this is the cut end. This is also the cut end of the posterior femoral cutaneous nerve. Okay, medial to it is this nerve. This is the nerve to obturator internus, and this is the pudendal nerve. Okay, pudendal nerve. Now listen, the three structure: nerve to obturator internus, pudendal nerve, and internal pudendal vessel, which is not showing here. It passes from the greater sciatic foramen to the lesser sciatic foramen to enter into this pelvis region. Okay, so these three structure you can memorize it by the simple like acronym PIN. Pudendal nerve, internal pudendal vessel, and nerve to obturator internus. These structures passes from the greater sciatic foramen into the lesser sciatic foramen to enter into the pelvis. Okay, so you must memorize it. Okay, so these are the nerve supply. Now we will talk about the greater sciatic foramen, and first the two ligaments which form the lesser sciatic foramen and greater sciatic foramen. You can see this muscle, it runs from the sacrum to the ischial spine. Okay, ischial, you can see this is ischial spine. This ligament is called sacrospinous ligaments, and this muscle, which is sacrotuberous ligament, it runs from the sacrum to the ischial tuberosity. Okay, this is ischial tuberosity, this is sacrotuberous ligaments. Through these ligaments, attachment of these ligaments make the two foramen. The upper one, this one is greater sciatic foramen, and the lower one below this sacrospinous ligaments and lateral to the sacrotuberous ligament is lesser sciatic foramen. Now we will talk about the contents of the lesser and greater sciatic foramen. The first content which is important for the greater sciatic foramen is this muscle, piriformis muscle. So the muscle content of the greater sciatic foramen is piriformis muscle. Now above the piriformis muscle, the structure which pass above the piriformis is this nerve along with its vessel. Superior gluteal nerve passes above the piriformis to supply the three muscle: gluteus medius, minimus, and tensor fasciae lata. It is also accompanied with the superior gluteal vessels. Okay, below the piriformis there is inferior gluteal nerve showing here, which supplies the only muscle, which is gluteus maximus muscle. Okay, this is inferior gluteal nerve. You can see it goes toward the gluteus maximus muscle. The inferior gluteal nerve along with its vessel, inferior gluteal vessel, passes below the piriformis muscle. This large nerve is sciatic nerve. This is cut end of the sciatic nerve. The deep nerve which passes through the greater sciatic foramen is nerve to quadratus femoris. This is nerve to quadratus femoris. Medial to the inferior gluteal nerve and sciatic nerve is this muscle, which is superficial. This is posterior femoral cutaneous nerve. Further medial is nerve to obturator internus, and this one is pudendal nerve. So these are the contents of the greater sciatic foramen. Now the lesser sciatic foramen, the muscle which passes through the greater sciatic foramen, lesser sciatic foramen, is this nerve which runs from the obturator internus and then obturator membrane. It is the obturator internus. So the muscle which passes through the lesser sciatic foramen is obturator internus muscle. Okay, along with it, the vessel is internal pudendal vessel, not showing here. Okay, and this is the nerve to obturator internus, and this is the pudendal nerve which passes from the greater sciatic foramen and enters into lesser sciatic foramen to goes into this perineum, pelvis and perineum. Okay, so this is the about the gluteal region. This is the another image of the gluteal region. This is the gluteus, the cut end of the gluteus maximus. Okay, the cut end of the gluteus maximus. This is the gluteus medius. This is gluteus minimus. You can see this is the piriformis. Below the piriformis is this long and the largest nerve, sciatic nerve. Okay, this is the superior gemellus. Okay, superior gemellus, and this cut muscle is obturator internus. Below the obturator internus is inferior gemellus. Okay, and above it is the superior gemellus. Below the inferior gemellus is this muscle which is quadratus femoris muscle. Okay, so the piriformis muscle pass through the greater sciatic foramen to comes to the gluteal region, while this obturator internus pass through the lesser sciatic foramen. Piriformis through the greater sciatic foramen, while the obturator internus through the lesser sciatic foramen. Okay, now we will see some other pictures of the gluteal region. Yes, so this is another picture. It is showing the gluteus medius. This is the cut end of the gluteus maximus muscle. Okay, this is the gluteus maximus muscle. You can see it, the gluteus maximus. Below it the gluteus medius, and further below is gluteus minimus muscle. This muscle is the cut end of the gluteus medius. This one is piriformis. Okay, below piriformis, above piriformis is superior gluteal nerve. You can see it, superior gluteal nerve and its vessel. Then below it is the piriformis muscle is sciatic nerve. Along with sciatic nerve is the inferior gluteal nerve, nerve to quadratus femoris, posterior cutaneous nerve of thigh, and the pudendal nerve. Okay, now this muscle is obturator internus. Okay, above it is superior gemellus, below it is inferior gemellus. This is quadratus femoris muscle. Okay, so these are the gluteal region. This is gluteus maximus muscle. This is the lateral part of the deep thigh which thickened. It is iliotibial tract, and it gives attachment to the two muscle gluteus maximus and tensor fascial lata. Okay, so this is about the anatomy of the gluteal region. Thank you.